Greetings, everybody. Welcome to Resilient Realities, a podcast on society's struggle. I am your host, Khadija Naveed, and I welcome you to the second episode, which is Unrealistic Beauty Standards. The main aim for today are that you must be able to answer 1. What are various beauty standards? 2. How do different beauty standards affect people? 3. How it affects the dilemma of the society. So now let us move forward and welcome our guests, Ms.Amna, Najeeb and Ms.Ramsha Tajammal, who are very well-known and acclaimed clinical psychologists known for having rendered a great amount of services to such topics including unrealistic beauty standards, which are known as the irrational dilemma of the society. How are you?
Alhamdulillah, I'm good.
I'm fine.
So let us move on to our questions. So how do unrealistic beauty standards affect the mental and health and well-being of individuals?
Basically, unrealistic beauty standards are like that you are too hairy. You should put on some makeup. You should eat more. You should work out. Unrealistic standards cause mental health effects. Unrealistic beauty standards create toxic environment which may lead to low self-esteem, body dissatisfaction, and mental health issues. People usually contrast exposure to idealized image may lead to comparison and feeling of inadequacy. Unrealized beauty standards can lead to body dysmorphic disorder, which is a mental health condition where a person spends a lot of time worrying about the flaws of their appearance. This disorder can be of body dysmorphic disorder, a mental health condition where a person spends a lot of time worrying about flaws to their appearance. These flaws are unnoticeable to others, but of any age can have BDD, but it's most common in teenage and young adults
Why is it more common in teenagers?
because of social media platform. People are like they used to see what is social media have and they want to be like them.
Okay, Miss Amna, accept body dysphoria, so which mental health conditions or disorders can be influenced by the pressure to conform to beauty standards?
Basically, there are a lot of mental conditions such as body dysmorphic disorder, eating disorders like anorexia nervosa, bulimia nervosa, which may leads to there are another also depression, anxiety, low self-esteem, social anxiety, OCD related to appearance, etc.
Miss Amna, that is very nice, but can you please make them much more easier for the ones who do not know about them?
Yeah, sure. Basically, eating disorders, anorexia nervosa and bulimia nervosa. In anorexia nervosa, it is a severe and a strong fear of gaining weight. People usually have fear to gain weight, and that's why they have a low body weight. And bulimia nervosa, it is an opposite condition in which it is uncontrolled episodes of overeating. Like people eat a lot in maximum in 2 or more than 2 hours. They eat more than a normal person can eat, and it can be genetic factor also, like which may lead from family to family, and it also can be cultural factor also.
Some indicators of distress or negative ideation stemming from these beauty standards.
Some indicators of distress or negative ideation stemming from these standards can include feeling of inadequacy, comparison to others, extreme focus on appearance, low self-esteem, low self-confidence, engaging in harmful behavior like excessive dieting or other cosmetic procedures, fear of failure, perfectionism, increased anxiety. More or comparison to others, extreme focus on appearance, low self-esteem, low self-confidence, engaging in harmful behavior like excessive dieting or other cosmetic procedures, fear of failure, perfectionism, increased anxiety. More
Ms. Ramsha into regard. So, Ms. Ramsha, how are you?
I'm fine.
So, Ms. Ramsha, can you please answer, like, how does body dysmorphia intersect with beauty standards and what approaches can be taken for its treatment or management?
Okay. Body dysmorphia often intersects with social beauty standards, as individuals with this condition obsessively focus on perceived flaws in their appearance. They are mostly focused on their self grooming. They always do a lot of makeup, and they just hate their particular part of body, maybe hands, eyes, or maybe something else. Or they also they always ask you how I'm looking, do I looking good or not. This type of, and the treatment approaches typically involve a combination of cognitive behavior therapy, medication, support therapy, should help them to change their negative thoughts to positive thoughts, beauty comes from inside. You are different, you are not ugly, and something like that.
Okay.
Specific demographic group may be models. They are more conscious on their appearance, their body, and we should help them to realize them that focus on yourself, focus on your beauty, self love, acceptance, prioritize yourself. Don't relate to others, and influence positive influences you should in your life.
Final question. So, what recommendations would you offer to individuals grappling with the psychological ramifications of unrealistic beauty standards?
Okay. It's essential to prioritize self-acceptance and focus on individual strengths, surrounding oneself with positive influences, seeking support from friends or professionals, and practicing self-care, and can also be a help in navigating the impact of unrealistic beauty standards on mental well-being.
So, Ms.Amna, would you like to add something?
Yes, first of all, we have to.
Amna, would you like to add something to it?
Yes, of course. First of all, we have to focus on ourselves, our self love. We should love ourselves as we are. We should remind ourselves and others that beauty comes in all shapes, size, and forms.
Thank you so much. This is going to be the final segment that will take a professional's view in consideration. In this segment, we are joined by Dr. Ahsan, who is a very famous name in the dermatology and hair transplant sector of Faisalabad. He is a certified aesthetic physician from King's College London. He is also a member of American Board of Aesthetic Surgery. He is a promising individual who has humbly taken on the aspect of entertaining our questions. Greetings, doctors. How are you?
I'm good. Thank you for having me in your podcast.
It was an honor, doctor. What is your specialization, doctor?
Okay, my specialization is basically doing aesthetic procedures, invasive, non-invasive procedures, liposuction, PRPs and PRF, and regarding all the aesthetic surgeries.
Doctor, that is very promising, but can you please make it easier for the ones who don't know about it?
Basically, at our aesthetic clinic, we are doing PRP procedures regarding platelet-rich plasma, PRF procedures regarding platelet-rich fibrin procedures, hair transplant surgeries, Botox, fillers for lip enhancement, Botox for wrinkles, and whitening injections, brightening injections. So basically in PRP, what we are doing is we are collecting the blood from the patient cubital vein, and then we centrifuge the patient blood in a centrifuge machine. After that, we will add some activators in that plasma and then inject on the patient's scalp. That will help in hair loss and patient who are getting bald earlier. So these PRP and PRF procedures are quite helpful for the patients who are getting bald.
Okay, doctor. So, doctor, what are different types of laser?
Okay, so basically there are three types of laser. For females who are going to be suffer from hirsutism, they are basically IPL laser, intense pulse light laser. Second type is diode laser, and third type is candela, which we are commonly known as NDAC lasers. Both three types are good for patients. Those patients who want their hairs to be removed permanently in 6 to 7 sessions, so we are normally recommend NDAC lasers.
Okay, doctor. So, how is hair transplant carried out? And if it is painful, why do people opt for it?
No, it's not painful. Basically, what we are doing is in hair transplant surgery, we are collecting the donor areas follicles. Basically, as you can see, the patient who are getting bald early in 20s or in 30s, so we recommend those patients to do some PRP or PRF procedures. But those patients who are getting older, like after 40 or after 50, so we normally recommend hair transplant. Hair transplant is basically a surgery. It's painless procedure. We are collecting some donor follicles from the patient's own hair and then incise those follicles into the recipient area of the patient.
Okay, doctor. So, what are the different age groups and gender that come to avail your services?
Everyone can avail our services. Regarding those patients who are 18 plus, we more normally recommend that those patients can opt it for IPL laser, diode laser, PRP or PRF procedures. But those patients as well who have some acne-prone skin or dermatitis, eczema or other skin and fungal infections, so all of the age groups can avail our services.
So, like, do the female come to you or the male? Like, which clients do you have more?
Mostly females, but quite a few males also come at our aesthetic clinic. As you know, our beauty standards have evolved from time to time, so everyone wants fair skin, everyone wants to be wrinkle removed face, everyone wants their lips to be plumped. So males as well as females both can come.
Okay, so, like, do you offer services that are much more, like, painful for the patients and they still opt for it?
Yeah, obviously, if you injecting on the patient face, it's quite painful. But yeah, females want their face to be plumped, their face to be wrinkle free, so they opted our services and they are quite happy after the services.
Do you see your patients still coming up to you after, like, going through societal expectations?
Yeah, definitely. Everyone.
Like, can you please share us our account of a patient that you have noticed going through societal expectations and pressure but still coming to you?
Yeah, most of the females, as their moms are come with them, and everyone, if their moms ask that in our society, they males regarding their husband wants a fairer skin or their skin to be plumped up. So yeah, there are too many females as well as their moms came to our aesthetic clinic and they want our procedures. So we recommend everyone can take these procedures, but yeah, up to this with the specialized dermatologist and specialized aesthetic physician, you can opt it all those our services.
Why did you opt for becoming a dermatologist? There are so many other things that you could have become.
It's a passion, I guess.
Was it more than a passion?
No, it's totally a passion, and when you study, you don't even know which field you want to be. So as long as your journey becomes, it's like a passion, and you enjoy your work. So that's how it's work.
Okay, doctor. Doctor, can you please share, like, how these very unrealistic beauty standards have played a very important role?
It's quite nostalgic talk, to be honestly, because at our societies, some ridiculous sarcastic people has come and they wanted their beauty standards to be evolved from time to time. For me, I guess it's a dumb reality, because women with their moms comes and they want to be skin hair free, but as you all know that testosterone and different hormones came plays a better role in our society. So hormonal in changes can bring the peoples to be came at our aesthetic clinic. And
Going ahead to some very other procedures, can you please talk about whitening injections and hydrofacials?
okay, so basically hydrofacial is very good procedure. Hydrofacial is basically hydrate your skin. People mostly going outside and they want to be skin to be dull, so hydrofacial is basically hydrate your skin, and there are 7 steps of hydrofacial, 14 steps of hydrofacial, depend upon the patient budget as well. So we will recommend patient, if their budget is low, then we will recommend 7 steps hydrofacial. If their budget is good, then we recommend 14 steps hydrofacial. And brightening injection is basically the correct word. Whitening injection is not good word for those procedures. Basically whitening injection is not white your skin, not shine your skin. These are basically brightening injections. So kindly correct this word. There's a myth at our society that whenever we inject the whitening injection, we will become like English peoples or abroad like people. So this is correct. So these are not whitening injection, these are brightening injections.
Okay, so doctor, do you think that why do people come to you for tattoo removal if they were the one that chose it?
Basically tattoo removal at our society, everyone wants their body to be built. So mostly bodybuilders come at our aesthetic clinic and they want their tattoo to be removed now. So when I asked them why you want to be your tattoo to be removed, so they said that at our society it's not good for in Islam or like that.
Doctor, can you now please talk about Botox and lip fillers?
Yeah, sure. Basically, lip fillers. What are lip fillers? Lip fillers are basically hyaluronic acid gel, which we inject on the submucosa layer of the lips. These are basically used to plump your lips, as well as nasolabial folds. Whenever the patient gets older, we use nasolabial folds filler to the patient which are getting old. So the science is same. We use 26 or 24 gauge cannula and then inject with the help of this cannula with the hyaluronic acid gel. So as long as Botox is concerned, Botox are basically botulinum toxin. These are basically used to paralyze the muscles. So we inject the Botox on the forehead of the patient, on the side of the eyes, on the orbicularis muscles and different muscles. So Botox and fillers both are very good, and the patient nowadays can opt this procedure. So it's a good.
People should hear. This is the last question. So, what is your opinion regarding the evolving beauty standards?
Okay, so basically, aesthetic treatments are not for disease. To be honestly, these are not for disease. If anyone who comes at our aesthetic clinic and they want lip fillers, we do lip fillers. But again, lip fillers, there is a hyaluronic acid gel. That gel has the ability to absorb water and getting your lips to be plumped up. But after 6 or 8 months, after the gel effect has been removed, that gel will be placed there for 2 to 3 years. So if once you can get into that procedures like Botox or fillers, you will need to carry on those procedures for the rest of your life.
Now let's move on to the third segment of this episode, which is to discuss the impact on an individual. For this, I would like to invite Lamia Riaz to shed some light on this. Lamia is a talented individual who has experienced people around her and herself being targeted because of unrealistic beauty standards. Hello Lamia, how are you? Can you introduce yourself?
Hi Khadija, first of all I would like to say I am so delighted and honored to be on this show. And as for my introduction, hello everyone, my name is Lamia Riaz and today I will shed some light on the issues and problems, all the societal pressure I had to face with beauty standards and my personal experience.
Thank you Lamia. So Lamia, why do you do makeup or get professionally ready?
Khadija, I do makeup and okay, so first of all, I would like to begin by saying that nowadays beauty is a type of power that people hold in their hands. Beauty is like a weapon. There is this thing, it's called pretty privilege. I am sure you've heard of it. If you haven't, it's just something that is benefiting you if you're pretty. Like for example, if you are good looking by the standards of the society and you do something that is considered annoying, it would not be considered annoying, it would be considered cute or cringy, quirky, something like that. Okay, so I would like to say that to kind of experience that power and kind of like wanting to be in that position, that's why I wanted it so bad that's why I decided that I would wear makeup everywhere I go. I would get dressed and I would probably properly get ready to go out anywhere so that I could get that pretty privilege, and so that people would praise me and I would not be looked down at by the society.
Thank you so much, Lamia. That is really heartwarming, and we really hope that you get through it. So, Lamia, moving on to the next question. How have societal expectations around beauty influenced your self-perception and self-esteem?
I would say that all this societal pressure had a very negative impact on my self-esteem, because now everywhere I go, I do not feel comfortable without makeup. The only version I remember of myself in my head is the one where I am fully dressed, wearing like 5 pounds of makeup on my face. And that's the only way I feel comfortable with myself, and that's the only way I can love myself. So I guess it had a very negative impact overall on my mental health and on my self-esteem and self-perception.
Thank you so much, Lamia. So moving on, Lamia, were there specific moments or incidents that made you realize the unrealistic nature of beauty standards and their impact on your life?
Okay, so first of all, I would like to say that nowadays makeup has been kind of not very popular in the beauty industry. It has all come to natural beauty now, which is not so natural, by the way. Nowadays, it's more plastic surgery, lip fillers, Botox, and other things like this, implants, etc. The beauty industry has truly come to this from makeup. They focus more on the makeup no looks. So I would just say that social media has overall nowadays on social media, though the girls who have lip fillers and plastic surgery like this, they go viral for having natural beauty. So that also had a really negative impact on my mental health, and it made me want to think about getting these lip fillers, Botox, lip injections, eye lifts, brow lifts, etc. Since all the celebrities do it, it becomes the beauty standard, right?
Yes, Lamia. Lamia, I'm really sad, but you're really beautiful. So, Lamia, in what ways do you think unrealistic beauty standards have affected your emotional well-being?
So, Khadija, especially being in your teenage years, these things it's like a phase you go through. It's puberty, right? So in this phase, you get acne and you get a lot of. Basically, it's just your hormones acting up, right? And I don't think I can confidently say that even one of 10 teenage girls nowadays is fully self-confident in herself and fully is able to love herself for who she is. So especially being a teenager, I think that it has had a very negative impact on my emotional well-being because I just feel insecure without makeup. I feel like everyone is judging me for the way I look, for the acne on my face, for how thin my lips look or how thin my brows are, etc. So whatever does not go according to the beauty standard, I just feel that people are judging me for it.
Lamia, Lamia, have you ever felt pressure to conform to certain beauty ideals? How did this pressure manifest in your life?
So basically, the whole not being having a low self-esteem, not having enough self-confidence, I think the root cause of it is not the beauty standard but the pressure that comes with the beauty standard, the pressure from the society. They who think that girls should be a certain way, and I'm not pinpointing anyone here, but there are certain individuals in our society who think that girls should be a certain way, like girls should have long hair, fair skin, and like big pretty eyes, and every country has its own beauty standards, right? But personally speaking, from my own experience, like even the people who live in my neighborhood, everyone in my surroundings, they all judge me for the way I look. If I lose weight, they comment on that. If I gain weight, they comment on that. If I have acne, they have something to say about that. If I don't, they have something to say about that as well. So whichever way I am, I've realized that I'm never going to be perfect for them, and they can never love me for who I am, but I can still love myself for who I am.
That's a very positive thought, Lamia. So, Lamia, how has the portrayal of beauty in media such as magazines, advertisements, and social media influenced your perception of yourself?
So, in magazines and even growing up as a child, I used to idolize Barbie, and I used to always play with them, just look at how perfect their bodies are, how perfect their hair are, their skin tone, etc. But I what I didn't notice is there were what I didn't notice was what impact it could have on me. Uh, and then, as a teenager, looking at Instagram models or real life models such as the Kardashians, who are very famous, as you might know them, Kylie Jenner, Kendall Jenner, etc., I grew up seeing all this beauty around me, and then I always looked at myself in the mirror and thought, why am I not this way? Why am I not as perfect as they are? But as I grew up, I came to realize that behind them is hours and hours, behind all those celebrities is hours and hours of effort by multiple people. It's all hair and makeup, and it's their job to actually do these things, do social media, advertise for certain products, so that people would be more attracted to those products and would want to get those products for themselves. So I realized that I wouldn't have a life like them. I would never want to have a life like them either, now that I have grown up and now that I've come to realize that I should just love myself for who I am.
Yeah, this is the last question. How has the journey of self-acceptance been for you, considering now you seem like a lady who has known trouble to these unrealistic beauty standards?
So basically, when I was a teenager, I was at my peak of insecurity, and I was at the peak of being pressured by all these beauty standards. But as I got older, I came to realize that I need to accept myself for who I am. And one day, I just got so sick and tired of all of this nonsense, and I just thought that physical beauty, honestly, it's just a lie. It's just like judging a book by its cover, and what if the book is not interesting? So what really matters is the inside, not the outside. That's what I came to realize as I started to grow up, and it has honestly been really rewarding for me, and it has been really amazing for me to know this and finally understand this, because now I can go outside without wearing makeup. I can meet people, I can do whatever I want without thinking about the way I look. All that matters to me now is what type of a human being I am and my personality. And now I just don't seem to manifest doing all these crazy procedures and plastic surgeries on my face. And I have accepted, I know that I know that God made me the way I am for a reason. And I just need to trust the process.
Thank you so much, Lamia. It was a wonderful experience having you, and we really hope that our audience is going to have a lot of fun and a lot of new feelings to learn from your experience. And we really hope that our audience will learn, and our audience will try to regrow and try to experience new things in their heart too.
Thank you so much, Khadija, for having me on this podcast. I really enjoyed this interview.
As we conclude today's episode, it's clear that unrealistic beauty standards continue to impact individuals on a profound level. From our discussions with psychologist Dr. Samreen, dermatologist Dr. Ahsan, and our brave client who shared their personal journey, it's evident that these standards not only affect self-esteem but can also lead to mental health and even physical harm. However, amidst these challenges, there is hope. By fostering self-compassion, seeking professional support when needed, and advocating for a more inclusive and realistic portrayal of beauty, we can work towards a society where everyone feels valued and accepted regardless of appearance. Thank you to our guests for the insights and to our listeners for tuning in. Remember, beauty is diverse, beauty is unique, and most importantly, beauty is within each and every one of us. Until next time, take care of yourselves and each other, and for the ones that are being affected by these standards. Thank you.